All I can say is wow. Thank you so much, Dr. Dillard and Dr. Hill, for having us here, but more importantly, sharing your story of what this is about and where you've been, where you've come from, where you are now, and where you're going. And for those in the audience and those on the web, if you didn't know why we were in Boyd Chapel on Shaw University, they told you. They told you why we are here as the National Academies and why this is so fitting and why we are humbled and honored that you let us into your house and that we are here in your midst. And Dr. Dillard, you said something in the foyer to me as I came in. You said, I'm a Christian, I'm a scientist. I don't see any problem with that, putting those two together. So that's what we're here today to explore is faith and how you put faith and health together and how you can use those assets to improve the well-being of communities and the people that live in them, and to close those gaps, as you said, with that. So to introduce myself, I'm Sanne Magnan, and I am one of the co-chairs of the Roundtable on Population Health Improvement of the National Academies. And I also want to extend my welcome to you here today in this historic place for this first of its kind workshop. I'm looking at collaboration between health assets and faith-based assets in communities to improve population health. You've heard about this historic campus that we're on and the first that it has had, and we are just delighted to be here today. We've been in existence for over 5 years now as the Roundtable on Population Health Improvement. We've been seen as a trusted venue for leaders from the public and private sectors to meet and discuss leverage points and opportunities that arise from the social and economic and political environment, ways that we can use all of that to achieve better population health. The Roundtable's vision is of a strong, healthful, and productive society which cultivates human capital and equal opportunity. This vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require robust national and community-based policies and dependable resources to achieve it. As one of its activities, the Roundtable holds workshops for members, stakeholders, and the public to discuss issues of importance for improving our nation's health. We've looked at a wide range of multi-sector partnerships to improve health and health equities. Multi-sector partnerships is seen by us as the vehicle by which we are going to improve population health. Recently, I was participating in a national initiative to improve health, and we wanted to have a list of these sectors with which to engage. To our surprise, there was no standard list available, and when we created a draft list, faith-based assets were not included, which we quickly rectified to add to a sector to partner with in communities. But it reminded me of the title of one of Gary Gunderson's books, and you'll hear from Gary later, called Deeply Woven Roots, Improving the Quality of Life in Your Community. So it reminded me that faith-based assets are often roots, and roots are often invisible until they're made visible. Although we've heard about some faith-based examples in some of our past workshops, this is our first workshop devoted to exploring faith, health collaboration, and highlighting some of the unique opportunities they offer to help improve population health outcomes. And we will create some guiding principles for working together. So it is our honor to be here at Shaw with many firsts. as you've already heard, and with its mission, which I particularly like that it includes enhancing the spiritual and ethical values of its students and transforming a diverse community of learners into future global leaders. So it's fitting that today we are here on one of our first. But it's not without trepidation that we entered into this realm. The topic of faith health is enormous, and there are many worthy subtopics that we could tackle. But we want to be clear about this workshop and its focus, the collaboration part. We're not here to explore the relationship between spirituality and health or the efficacy of specific religious acts such as prayer in improving health outcomes. It's also not intended to explore how healthcare entities can undertake specific components of spiritual practice or how religious congregations can take steps to improve the health status of their members. This workshop, and you'll hear more from Gary about it, was intended to explore collaboration between community faith entities and the health sector, public health agencies, hospitals, universities, etc., and highlight effective practices that can improve population health. Organizing this workshop would not have been possible without the planning committee members listed on your agenda. Terry Allen, Mohammed Babar, Heidi Christensen, Gary Gunderson, Barbara Holmes, myself, and Prabjot Singh, who you will also hear from later today. Bio sketches for them and today's speakers are included in the package you picked up at registration. The packet also includes resources and readings prepared by the National Academy staff with input from the planning committee and speakers. A proceedings of all the workshop will be prepared by an independent rapporteur, and all participating today will be notified of its publication. If you are on Twitter, please use the hashtag PopHealthRT in reference to this workshop. At the end of the day, my fellow co-chair, Josh Sharskine, who was stuck in a snowstorm up on the northeast coast, will share brief reflections on the day and welcome those from members and other participants. So think about maybe anything that particularly hits you today that you want to highlight at the end of our workshop.